Canada is well positioned to provide access to safe and effective COVID-19 vaccines for all Canadians, and an initial supply of vaccine is expected to become available in early 2021. We know that supplies will be limited at the outset. Therefore, Canada's National Advisory Committee on Immunization, or NACI, has released its latest guidelines, providing further recommendations for the initial sequencing of key populations for early COVID-19 immunization. NACI recommends that initial doses of authorized COVID-19 vaccines should be offered to residents and staff of congregate living settings that provide care for seniors, adults 70 years of age and older, beginning with adults 80 years of age and older, healthcare workers, including all those who work in healthcare settings, and personal support workers whose work involves direct contact with patients, adults in Indigenous communities where infection can have disproportionate consequences. These 4 groups of people, as things are rolled out, should be covered by the initial doses. But I just have to caution that given there's so many different parameters and uncertainties, we just have to be prepared for unexpected things to happen, deliveries, etc. But I think the bottom line to your question is that those 4 categories were informed by an assumption that we will get 6 billion doses.
Regulatory approval of the Pfizer vaccine, as Minister Hajdu just mentioned, appears to be forthcoming. Rolling approvals for Moderna, AstraZeneca, as well as Johnson & Johnson are ongoing. Based on the best scientific data available to date, and on the recommendation of the Public Health Agency of Canada and the Vaccine Task Force, Canada is exercising options for an additional 20 million doses of the Moderna vaccine candidate. This will bring Canada's total allotment of this vaccine to 40 million doses to be delivered in 2021. Given the need to transport and store some vaccines at sub-zero temperatures, we have already established the capacity to store up to 33.5 million ultra-frozen and frozen vaccines at any one time. More freezers are on the way to further expand our storage infrastructure.